It's Medicare Education Week. And if you are approaching Medicare, or if you've had it for years, or maybe your parents are approaching it, I'm sure you could use a refresher on the topic. It can be a very difficult thing to comprehend. But like I said, Dr. B's here, and he's going to help us understand it all better with Medicare and Medicare Advantage. Morning, Dr. B. How you?
Hey, Tommy. I'm doing well. How about you?
I'm all right. The knee's coming around, I guess, but it's only been
Good.
3 weeks. We got to give it some time. Let's start, I guess, Doc, with the different parts of Medicare.
Sure, yeah, it can get a little bit confusing, but basically there's 4 parts of Medicare, parts A, B, C, and D. And the best way to think about it is Part A really covers all hospital procedures, so anything in the inpatient setting. And then Part B covers anything in the outpatient setting, so that's things like your doctor's visits and preventative services and things like that. And then Part C is actually Medicare Advantage plans, like People's Health, which are offered by private companies that partner with Medicare to provide those benefits. And then the last one is Part D, and Part D is for drugs, so that's your prescription drug coverage. You can buy that as part of another plan, or you can get that as just a standalone policy to cover any medications that you're taking.
From what I've heard so far, Doc, you're going to need Part D just to deal with Parts A, B, and C. Tell me about original Medicare. What is that?
Yeah, so original Medicare is really just the Parts A and B that we were talking about. And everyone gets Part A when you reach a certain age or you have certain qualifications. You get that Part A, and it doesn't cost you any money. Part B, however, is something that you have to opt in for. And like I said, that covers doctor visits and any outpatient or preventative type services. It also covers things like diagnostic testing, X-rays and EKGs and stuff like that. So you actually have to sign up for the Part B itself.
The age is what, 65? When do you become eligible for this?
Yeah, 65, and in certain cases you can be under 65 if you have certain qualifying disabilities. So you have to check with the Medicare office to see when you're actually eligible. But in general, it's most often when you turn 65.
So wait, is this free, or does part of it cost something, the other part doesn't? Walk us through all of that, please.
Yeah, so if you've worked and you've paid Medicare taxes while you were working, then there's no premium or no monthly payment for that Part A service. But like I mentioned, if you add on Part B to cover all of those doctor's visits and outpatient procedures, then there is a premium, and that premium's basically based on how much money you made in the prior year. So it can vary from year to year, and typically will go down after retirement. But if you're over 65 and you're still working, you may have a slightly larger premium. Then the other thing that you have to remember about Medicare is that you also have to pay a deductible for original Medicare services. So you have to meet that deductible, which is a certain amount of money that you pay for any of the services, and then Medicare will jump in and they'll pay their percentage of the cost share as well. And the one thing that's real important about original Medicare for people to keep in mind is that there's no limits on those costs. So if you have a major surgery performed and the copay or the coinsurance is 20% of $10,000, then you may have to pay all the way up to $2,000, and that can continue for the entire year. There's no maximum amount where they stop making you pay that coinsurance.
Wow. Let's talk about Medicare Advantage then.
Yeah, so Medicare Advantage is a little bit different. So that's known as Part C. And like I mentioned, Medicare Advantage plans are offered through private insurance companies that have contracts with Medicare. And what they do is they actually package up those Medicare services, often with a Part D plan, so often with prescription drug coverage as well, so that you can actually get all of the Medicare services, but in addition, you can actually have your Part D and sometimes even additional services, things like dental and vision type coverages. The other thing that's a big advantage of Medicare Advantage plans is that you usually do have a maximum amount that you can actually pay out of pocket each year.
What is creditable prescription drug coverage?
Yeah, so the government actually requires that people have a Part D plan if they're on original Medicare. And so sometimes when you've worked and you've retired, your business may actually offer you something called a creditable Part D plan that actually provides that drug-only coverage into retirement. But it doesn't cover any of the additional services, so you'd have to either go with original Medicare or you'd have to sign up for something like a Medicare Advantage plan.
And is that what they call by the donut? I'm sorry, I'll get it out. The donut hole, is that what they mean?
It's a little different. The donut hole is actually just a part of the Part D plan. And what that means is that the insurance will pay for your drugs up until you reach a certain dollar limit. And then when you get in that middle range, the low level all the way up to what the high level of payments are, you actually have to pay a greater cost share for the medications. So another advantage of Medicare Advantage plans like People's Health is that a lot of times they have coverage for drugs through the donut. So even though with original Medicare and a regular Part D supplement, you may have to pay for some of those blood pressure meds and cholesterol meds, but with a lot of Medicare Advantage plans, those are actually covered through the donut.
I'd much rather be talking about real donuts, but we can't, Doc, because this is serious stuff. And we'll continue when we come back. Two questions pop up here on the text line, 504-260-1870, the Mortgage Financial phone and text line. One of them, can you ask the doctor to talk about benefits of a Medicare Advantage plan? And another one asks, what about costs as it relates to Medicare Advantage? So Dr. B will answer all of those questions and more when we come back. It's 8:21. It's time for traffic now on WWL. 25, Tommy Tucker, WWL, talking to Dr. Brent Wallis, our friend Dr. B, as we do every Thursday, Chief Medical Officer of People's Health, about senior health to help you, if you are a senior, or your parents, navigate the sometimes choppy waters of senior health care. And boy, you talk about choppy. Medicare, that's what we're talking about today. And People's Health is sponsoring a virtual concert with the World War II Museum. I'll tell you more about that later. All right, Dr. B, so the benefits of a Medicare Advantage plan.
Sure. One reason why people go with Medicare Advantage plans is because they offer benefits that original Medicare doesn't. So original Medicare doesn't cover things like dental exams, vision coverage, hearing aids even. And so if you think about it, a routine dental or eye exam can cost you a couple $100. So with a Medicare Advantage plan, that can be included in your coverage, usually at a $0 copay. Some of the other things that Medicare Advantage plans can offer are things like a fitness center membership, which is really important for our seniors to stay healthy and helps with falls. And then another advantage is that they usually have a nursing staff which is available to help you with any of your chronic or long-term illnesses, and those are very prevalent in the senior population. So it gives you the opportunity to speak with someone about your medical conditions and to kind of help you navigate and guide you through the system.
So how much does something like that cost, Medicare Advantage?
So you still have to pay your Part B premium, so, in order to have Medicare Advantage. So like I said before, that's going to be determined by what your salary was when you were working. And then adding a Medicare Advantage plan on top of that often is actually no dollars at all. So with our People's Health plans, we have $0 premium plans that offer additional benefits, but don't actually cost you anything out of pocket. The other thing to kind of take into account is what I had mentioned around the deductibles and co-payments. It gets very confusing, but one of the biggest advantages of Medicare Advantage plans, unlike original Medicare, is that it limits the amount of money that you may pay in a year. So if you've got medical conditions that you're having treated or you're dealing with on an annual basis, you can kind of establish what your budget is going to be to pay for those services with a Medicare Advantage plan, whereas with original Medicare, you may have a little bit more difficult time knowing how much you're going to pay out of pocket.
So how do you choose what's right for you? I presume that's kind of what People's Health does. And also, tell me about this star rating somebody texted in about.
Yeah, so really the first thing you should look at is cost. I mean, most of our seniors are on a fixed income, so you have to consider how much you're capable of paying. You have to understand what your Part B premiums are, and then all of those deductibles and other things that I talked about. The other thing is looking at what coverage you need. So, you may want a different type of insurance plan if you're real healthy, but if you have a lot of chronic medical problems and you're taking a lot of medications, then you want to pick a plan that's going to cover a lot of those things. And then, like we just talked about, those additional benefits, if that's something that's useful to you, it's very important to get your eyes checked regularly, to go to the dentist. We talked about the fitness benefit. So if those are things that you're interested in, then Medicare Advantage is usually the better way to go. And then, just to emphasize what I said about the coordination of care, a lot of times seniors have difficulty navigating not just through Medicare, but also through hospitals and through doctor's visits. So Medicare Advantage can actually help you coordinate your care a little bit better. And then kind of the last thing is what you just mentioned, which is the star rating. And so all Medicare Advantage plans on an annual basis are measured in terms of the quality that they provide. And Medicare actually posts that on their website at medicare.gov, and it's a star rating from 1 to 5 stars, with 1 being the lowest rating and 5 being the highest. And what Medicare is doing is they're really rating those plans on their ability to provide care, in a fair way. They're looking at whether the members in that plan have gotten all of the screening tests that they're supposed to. So it's a real good measure of the quality that you would get if you sign up for those plans. And I'm real happy to say People's Health is the only Medicare Advantage organization in Louisiana to get the highest rating in the state, which is 4.5 out of 5 stars right now. We've gotten that for the last 3 years in a row.
You guys got more stars than the Big Dipper. We're going to take a break. I'll tell people about how they can enroll in more when we return. Dr. B, I know you're busy. Thank you for your time. This is very important stuff, and we might even discuss it again one week. Thank you, sir. Have a good week. And
Thanks.
Dr. Brent Wallis, good to talk to you again. Dr. B, Chief Medical Officer of People's Health. A little bit late, 8:31, time for WWL First News. For that, we quickly go to date.